Blephasteam User Guide. This video consists of components, first use and further use. Introduction. Blephasteam is a moist heat device that will help alleviate the symptoms of dry eye, blepharitis and MGD. Components. What are the components of a Blephasteam? The Blephasteam consists of a mask and a base charging station that it sits on to charge. A power cord comes out of the base charging station that plugs into the wall. The other components in the box include the water tray and the face seal, also known as the water carrier. This is the crucial interim piece that fits inside the mask after it has been sitting in the water tray, that provides the moisture and creates a seal against your face. There is also a microfiber cloth to keep the screen scratch-free when inserting the face seal. This cloth can also be used to clean the device between uses. The Blephasteam package also comes with two bespoke AA batteries that are unique to the device. These are the only batteries that can be used with the device without damaging your device and voiding your warranty. A bespoke screwdriver is also provided to access the battery compartment, located at the top back of the face mask. Be sure to keep this screwdriver safe, as it is required to change the batteries. The batteries typically need replacing every 6 months with normal use. There are also two user manuals included in the box, a quick start manual, as well as instructions for use. There's also a container which can be used to transport your Blephasteam or store it when not in use. First use. Step 1. Firstly, begin by installing the Blephasteam batteries. Use the Blephasteam screwdriver to remove the rubber Théa symbol inside the top of the mask to reveal a screw. Use the screwdriver to remove this screw. This will reveal the area in which you need to insert the two Blephasteam batteries. Please ensure to insert the batteries correctly as indicated here. If the batteries are not in place correctly, the device will not work. Once the batteries are inserted, you need to replace the cover and securely screw the cover closed and replace the small rubber piece. Step 2. Before you go further, it is recommended at this point to try on your mask with the face seal in place. Ensure the strap is at the correct length and the mask is fitting comfortably to your face. Once you are content with the fitting, remove the face seal so it does not interfere with the charging or the heating of your Blephasteam. Step 3. Your Blephasteam needs mains power to charge the rechargeable batteries located in the mask. In order to use your Blephasteam, you need to first charge it. You do this by placing the mask on the base charging station and then plugging the base charging station into the wall. Make sure there is power in the wall socket. There will be absolutely no lights on either the base charging system or the mask if no power is getting to the Blephasteam system. Once the Blephasteam is receiving power from the mains successfully, the blue Théa logo will illuminate at the bottom right of the charging base station. There will also be a blue Théa logo illuminated on the top left of the mask. If this light is not visible, the mask may not be sitting correctly on the base charging station. If this is the case, lift up the mask and replace it, so that the two metal charging ports are fully sitting into their respective charging ports on the base charging station. Make sure there is nothing getting in the way, such as the head strap, the water tray or face seal. Move these out of the way. A beep will sound to confirm that power is getting to the mask and the batteries are charging. While the batteries are charging, a green battery symbol will slowly pulse on the mask. On first use, allow up to 4 hours for the battery to take their first charge. After that, batteries typically require up to an hour to recharge. While the batteries are charging, the Blephasteam will not work until the batteries are fully charged. When the batteries are fully charged, the green battery symbol now disappears. Your Blephasteam is now ready to be heated. Always charge the device after use. The device can stay on the charger between uses. After several minutes, the Blephasteam device goes into sleep mode. To reawaken the device, simply lift the Blephasteam off the base charging station and replace it. Depending on how much time has passed, you may need to allow the batteries to fully charge up again. Step 4. The Blephasteam can now be set to preheating. This can be done by pressing the Start touch. This is sometimes referred to as the Start button. It is important to note that this button doesn't depress. The touch of a finger is all that is required to begin the preheating. It needs to be sitting on the base charging station for preheating to work. The heating button will not illuminate if the battery is still charging. If the battery is still charging, you will need to wait until it completes and the green battery symbol disappears. Once you have pressed the Start touch, you will know that the preheating has begun because the device makes a beep and the orange goggle symbol appears on the mask. The device will continue to beep during the heating cycle. This is to let you know that it's heating. This typically takes less than 5 minutes. Step 5. If you haven't already done so, take the water tray and lay it flat on a surface. Fill with clean cold water. And place the face seal into the tray, with the rubber seal facing up. Bottled, filtered, still water is best. Do not use tap water. Step 6. When the device has reached optimum heat and is ready to be worn, the device makes 3 consecutive beeps and the orange goggle symbol changes to a pulsating green goggle symbol. The 3 beeps continue to beep every 5 seconds until the device is removed from the base charging station. Place the mask on the cloth provided and insert the face seal inside of the mask. Then, put the mask onto your face and pull the strap over your head to ensure the mask is fitting comfortably. This session will last 10 minutes. Step 7. The mask will beep automatically to indicate that 10 minutes have passed. You do not need to set a timer. Once the 10 minutes have finished, remove the mask from your face. Remove the face seal and then place the mask back onto the charging base station. Always charge the device after use and before storage. Further use. Recommended use depends on the diagnosis from your healthcare professional. General recommendations would be to use the Blephasteam twice daily when treating a specific condition and once a day as part of your regular eye care routine. The recharge can take anything from up to 60 minutes. The base station can remain plugged in, except if it is not in use for a long time. The face seal needs replacing every 3 months. The batteries will need to be replaced after 12 months of use, but it is dependent on how often the device is used. The batteries have been specifically designed for use with Blephasteam. They do not hold a charge and cannot be recharged using alternative battery rechargers. Do not use any chemical detergent when cleaning the mask, as this could damage the device. Do not submerge the device in water or put into the dishwasher. Never put your Blephasteam in the microwave. You can see through the Blephasteam when it is in use. It is not recommended to do daily household tasks or lie down whilst using the device. If you have further questions or issues, please contact us or click the link below.